Thinking back to a decade ago in 2020, we had an ambitious goal. Over the past decade, we've been a relentless force for a world of longer, healthier lives. Your lives. With equity at the center of our work, we added years of life to millions of lives. But not just any years, healthy years. Healthy life expectancy is now the norm. People are living their best life in their best health. And not just here at home, but around the globe. Together, with your help, we collaborated our way to gifting families near and far the precious gift of time.
The 2030 goals are bold and ambitious. The 2030 impact goals, which guide our mission to be a relentless force for a world of longer, healthier lives, are to equitably increase healthy life expectancy from 66 years to at least 68 years in the United States, and from 64 years to at least 67 years worldwide. Over the past 2 decades, the impact goals have driven efforts to reduce mortality from cardiovascular disease and stroke, while progressively emphasizing disease prevention and improved cardiovascular and brain health. So over the past 2 years, a committee of AHA volunteers and staff, guided by the AHA board, have worked to craft the 2030 impact goals. The group started with the AHA's mission to be a relentless force for a world of longer, healthier lives, and anchored the goals in an understanding that in order to achieve cardiovascular health for all, the AHA must expand its focus and engagement to include overall health and well-being, and also to further address health equity. The 2030 impact goals expand the AHA's focus and are a powerful extension from prior years. They build on the work and lessons learned from the 2020 goals and place more emphasis on wellness and social determinants of health. Using the Health-Adjusted Life Expectancy, or HALE metric, commonly referred to as healthy life expectancy or healthy years. HALE is the years that a person expects to live in full health by factoring in years lived in less than full health due to disease or injury. For example, a woman who dies at age 80, has a stroke at 62, and is paralyzed for 18 years has fewer healthy years than a woman who dies at 80, has a stroke at 79, and is paralyzed for 1 year. The HALE metric is well suited to estimate longer, healthier lives in the United States and worldwide because it encompasses both cardiovascular health metrics and cardiovascular and stroke mortality. And national and global HALE estimates are reported annually for nearly 200 countries and territories. HALE was selected as the optimal metric based on 5 key criteria, including number 1, embodiment of the AHA mission and values, number 2, contemporary relevance, number 3, validity, number 4, modifiability, and number 5, data analytic consistency and frequency.
You know, the policy priorities to ensure that we can achieve the 2030 goal for health-adjusted life expectancy require that we have the capabilities of assessing trends and availability of a number of key determinants of health, including healthy eating, access to outdoor physical activity, a tobacco-free life, including not only tobacco but also vaping and other forms of smokeless tobacco, and then access in a timely fashion to infrastructure that enables us to foster the diagnosis, treatment, and control of a number of high-risk conditions, including hypertension, hyperlipidemia, diabetes, chronic kidney disease. And so these are really critical determinants of our capabilities as a society to achieve health-adjusted life expectancy as articulated in 2030 goals. And therefore, we need to equip ourselves as a society with the ability to measure progress along those trends. The critical issue for us as a society to be able to monitor progress towards improvement in health-adjusted life expectancy is really to equip ourselves with the proper measuring tools. And these measuring tools can be schematically summarized by the word surveillance, which means to equip ourselves with the tools to assess the trends and the key determinants of health. And so specifically, the American Heart Association is committed to support a number of initiatives, both at the federal, state, and local level.
So the U.S. and the world, the HALE metric that we've been talking about is healthy life expectancy. And the good news overall is healthy life expectancy has been increasing in the U.S. and around the world. However, the rate of increase has been plateauing, and even in some areas is reversing as people are getting sicker sooner and die younger in certain regions. So there are large disparities in healthy life expectancy across the U.S. For example, between states with the highest healthy life expectancy and the lowest, that can vary by as much as 7 years. As mentioned, while both cardiovascular health and cardiovascular mortality have improved overall in the U.S. in the last decade, importantly, disparities also exist within states along other key dimensions such as education, income, race, ethnicity, and urban versus rural residents. Importantly, there are large differences in healthy life expectancy globally. Recent data shows differences of almost 14 years between low-income and high-income countries. So really addressing these disparities is critical to improving both individual lives as well as the health of communities and overall healthy life expectancy across the U.S. and across the world. So putting health equity at the center of the goals, both in the U.S. and globally, was very important for the task force. Really, health equity implies that everyone should have an equal opportunity to obtain his or her full health potential. And no one really should be disadvantaged from achieving this throughout their life. And really, it is important if we're going to reverse the widening disparities between more and less advantaged groups, both in our nation and around the world, that we really address equity so that we can truly improve health and well-being outcomes for all. So really addressing health equity aims at two key elements. One is by reversing the widening disparities between more and less advantaged groups, we're able to improve health and well-being outcomes for everyone in an absolute sense, and at the same time, by closing the gap between populations in health and well-being, that's really the best way to ensure sustainability of these health improvements for all. So a key part of the strategy is to address technology and its potential to help us increase healthy life expectancy as well as measure its progress. Technology is advancing at a rapid pace, and the AHA is committed continuing to provide and enable resources to develop research and innovations as they evolve. The AHA is very committed to investments in information technology, communication infrastructure, and important topical areas such as mobile health, artificial intelligence, and precision medicine. Because the 2030 goals are so ambitious, the American Heart Association recognizes that it can't do this alone. It really will require working collaboratively with many diverse groups, ranging from local neighborhoods to global government. Additional improvements are going to need to come through increased efforts around prevention, population-level public health policies, the establishment of effective, comprehensive, and affordable healthcare systems, and modifications to individual lifestyle behaviors. New collaborations with diverse sectors, organizations, and communities across the globe that focus on overall health and well-being and address equity among everyone are needed, no matter their race, ethnicity, income, or other demographic or geographic characteristics.
The 2030 impact goals are bold and ambitious. They're centered on equity and well-being. In order to achieve these goals, we cannot do this alone. We need you.